In the United States, 9,000 high school athletes are treated for exertional heat illnesses yearly. Heat exhaustion and heat stroke are two examples of exertional heat illnesses athletic trainers need to know how to diagnose and treat. Heat exhaustion is primarily characterized by the patient's inability to continue exercise. They may present with fatigue, collapse, dizziness, headache, confusion, pale skin, dehydration, and lightheadedness. These patients will also have a rectal temperature of less than or equal to 104 degrees Fahrenheit. Exertional heat stroke may present with similar symptoms to exertional heat exhaustion of confusion, dizziness, collapse, dehydration, headache, and fatigue. The two characteristics that differentiate exertional heat stroke from other heat illnesses are a rectal temperature of 105 degrees Fahrenheit or greater and obvious central nervous dysfunction, which is often seen as a personality change or combativeness. Taking a rectal temperature is the only accurate way to assess core body temperature. This can be done by positioning and draping the patient appropriately, cleaning and lubricating the flexible thermometer, and turning it on. The thermometer is then inserted 4 inches past the anal sphincter. A flexible thermistor can be taped to the patient's body for continual readings. If a flexible thermometer is being used, core temperature should be reassessed every 5 minutes. Treating a patient with exertional heat exhaustion involves moving them to a cool, shaded area, removing excess clothing, cooling them with ice towels, rehydrating, and monitoring vital signs continuously. Treatment for a patient suffering from exertional heat stroke is centered on cooling them as quickly as possible, either in a cold water immersion tub or by using the taco method. Ideally, a pool would be between 35 and 55 degrees. Water should be continuously stirred, and any changes in rectal temperature should be monitored. Cooling should last for about 15 to 20 minutes or until the patient has reached a rectal temperature of 102 degrees. Then transport to the nearest emergency department is appropriate.